Grady Core here with Core Plastic Surgery, and I am here with my chief clinical nurse and supervisor of many, many years, Beth Terrasoli,
Hello.
who I think is the greatest plastic surgery nurse in the United States, if not the world. And today we're going to talk a little bit about lasers. There's been a lot of interest about lasers. We do a lot of lasers. Beth actually does most of the lasers in our clinic. And we want to talk a little bit about expectations of lasers versus having surgery. I'm going to ask Beth a few questions about lasers and how she does them. But first, let me say this. Lasers do help you stay young. So skin rejuvenation, beautiful skin is a large part of looking young, regardless of the structure of your face. But they cannot replace surgery that will put your face back where it used to be. You know, they don't equal each other. So a lot of lasers will not make you look like you've had a facelift. So first thing I'm going to do, I'm going to talk to Beth, and I'm going to ask her a little bit about what kind of lasers she does most commonly, and what do you think that does for people?
So I would say my favorite laser procedure would be the Halo, because it combines non-ablative and ablative technology.
What do you mean by ablative?
So people will say, what do you mean when you say ablative? Yeah. When you have a resurfacing laser, you're left with kind of like a raw surface. So you have topicals we put on and new skin grows. So the lasers that I perform drives channels into the skin, but you do have healthy skin around each of those little channels. So it's kind of like, we explain it like aerating a golf course. So with Halo lasers, we're working to, prevent further skin damage. We're looking to help with fine lines and wrinkles. The deeper wrinkles require more of an ablative laser like Dr. Core does. But for what I do, I'm working with just the surface skin quality, and also transferring heat deep down into your tissue to help stimulate collagen and elastin, which by age, your late 20s to early 30s, that kind of starts to decline.
So how does a Halo heal differently than a more powerful resurfacing laser that I would do? How does it heal differently?
Heals differently because, like I mentioned, you have healthy skin around each of these little channels that I'm creating in your skin. So the skin is actually able to repair itself a lot faster than with an ablative laser. Although an ablative laser downtime is still around 7 to 10 days, with a Halo you're looking at around a 4 to 5 day downtime. And the nice thing about Halo lasers, the very next day you're able to put sunscreen on. So you can wear your tinted sunscreen and wear your lipstick and your eye makeup by day 1 actually. And people are able to go back to work and go to Target, Publix, and unlike a resurfacing laser, you typically want to stay out of public for a few days until your skin starts to resurface.